Hello and welcome to Rise and Unwind. My name is Dan. You know, each and every week we talk to people from across the country about things you can do right here in your neighborhood. And on this week's show, we got this.
Parents have their children on their shoulders and they're up there going like, yeah, shout. And you're like, dude, you're like 9 years old. How is this happening? You know, it literally is the best feeling ever to know that your music has transcended.
Frames are designed to stay in adjustment. Check this out. They bend and pop right back into shape.
How is the plan you're in today going to change for next year? And then evaluate, is it going to meet your needs?
All of that and more right here on Rise and Unwind. Do you ever dream of uncovering lost treasure, exploring ancient tunnels, or even chasing down history's greatest mysteries? You know, Josh Gates lives that adventure for real. And he's back with brand new seasons of Expedition Unknown and Expedition Files on Discovery Channel. Fresh off a daytime Emmy win, Josh's latest expeditions dig deeper than ever, from inside Egypt's Great Pyramid to tracking hidden treasures around the world. Josh, it's great to see you here.
Thanks for having me, man.
All right, I guess without giving out too much away or spoiling for everybody, what is one moment this season that you thought to yourself, I can't believe we're actually pulling this off?
I think it's our season premiere, which is this big 2-hour, 2-part special on the Great Pyramid of Giza. And look, this building, which is 4,500 years old, has always inspired conspiracy theories and mystery. And so we are going to crawl through every inch of the Great Pyramid, sections that are closed to the public. We're going to descend deep beneath the pyramid into the bedrock itself. And to be down there in those tunnels was just such an absolute, electric thrill. And to take our viewers with us, that's the moment where I was like, I can't believe we're doing this.
Fans love both Expedition Unknown and Expedition Files. Can you give us the elevator pitch? What is the biggest difference between the two shows and why people should be tuned in for both hours?
Sure. I mean, Expedition Unknown is our boots on the ground exploration adventure show. So we spend the whole hour, or in the season premiere, 2 hours, investigating far-flung mysteries around the world. That's where we're going to be crawling in tunnels, macheteing through jungles, diving into the unknown. Expedition Files, we are able to tackle 3 stories per hour, and these are incredibly iconic mysteries. I serve as a kind of guide through those stories, taking our viewers into the past, meeting experts and authors and historians that have, revelations, breaking news about some of the most famous cases in history. So that's really kind of pulling open the adventure filing cabinet and looking into these really awesome stories. And Expedition Unknown invites you to literally get dirty and get out there in the world with us.
Josh Gates says, if you want to be a Bilbo Baggins and go on an adventure, pull a Nike and just do it. See, like I put 2.
Just do it.
Yeah, there you go. Josh Gates, I want to thank you for joining me today. If you are into real-world mysteries, big swings, and a host who actually gets dirt under his nails, watch Josh Gates on Discovery. New episodes of Expedition Unknown and Expedition Files on Wednesday nights. Check your local listings and stream full episodes at discovery.com. Thanks for hanging out with me, Josh.
Hey, all the best, man. Thank you so much for having me. I appreciate it.
For millions of Americans on Medicare, the calendar is getting loud right about now. There's no one-size-fit-all plan. With the deadline to enroll for next year just around the corner, this is the moment to double-check your coverage. From premiums and prescriptions to extra benefits, the choices you make now can actually shape your health care and your budget and what it will look like in 2026. So joining us from United Healthcare is Amanda Weigel, Senior Director of Product Strategy, to help make that process a little easier. Amanda, thanks for being here. We need your help.
Thank you for having me.
Okay, for people enrolled in Medicare, what makes this annual enrollment window so critical instead of something that we could all just let roll over?
Yeah, it's really important to use the annual enrollment period, which runs October 15th now through December 7th. So as you said, the time is now to use it, to really understand how is the plan you're in today going to change for next year, and then evaluate, is it going to meet your needs, or do you need to shop for coverage? And if you decide to shop, again, you want to make that decision by that December 7th deadline.
And when somebody sits down to compare some of the plans, what practical advice do you have to make that process of choosing a plan feel less overwhelming and a bit more manageable?
Yeah. I would encourage people to start with just understanding how they use their plan this year, what benefits were important to them, and then evaluate their plan and how it's changing against their priorities. If you do decide to switch, be mindful of how things like a monthly premium, how copays and deductibles will look next year so that you can understand those cost impacts as as you use your plan, those are the costs that are going to add up. For that reason, Medicare Advantage plans tend to be popular because they offer some cost protections. Many of the plans have a $0 monthly premium, and then they do cover preventive care at a $0 copay and offer cost protection specifically around out-of-pocket costs with a limit on the annual amount you'd spend every year.
Okay, you got the monthly premiums, you got the copays. So what other key factors should people be paying attention to as they review their Medicare options?
I really encourage people to make a list of the doctors they see and make sure that those doctors are still available to them in 2026. You're going to want to consider if you're willing to use specifically a plan's network and keep your costs a little bit lower as a result. So Medicare Advantage plans offer HMO products. Those products do offer you lower costs as you use your plan and usually have a bit more benefit stability, but you do need to keep your care within that plan's network. So that's something to check. Another thing that people are commonly surprised by is that Original Medicare does not cover routine dental, vision, or hearing services. Most Medicare Advantage plans do, so that's a great option for you if coverage for those things are important. And then finally, just like with doctors, make a list of the prescriptions you use and make sure that they are covered by your plan next year, and also understand what your costs might be for next year. You don't want to have any surprises.
But are there any benefits or features that actually might surprise people, things that they may not realize or available in some plans for next year?
Yeah. There are a lot of Medicare plan options available in most markets. So again, I encourage people to take the time, understand what is available to them. And something that people might not always consider is a special needs plan. So this is a type of Medicare Advantage plan. There's two common special needs plans. The first being for dual eligible. So this is someone that is eligible for both Medicare and Medicaid. And then the second is a chronic special needs plan. This is for somebody that's living with a condition or that's a chronic condition, something like diabetes. Being eligible for these plans and then enrolling into them can really save a lot of money and help just give you more coverage and benefits. So it's absolutely something to check your eligibility on.
And for anyone that wants a little more help before the deadline hits, where can they go get some information and maybe help compare these plans?
The good news is there are many great resources. I would really recommend visiting Plan Finder on Medicare.gov. That's going to give you access to all plans that are available to you from all carriers. If you're specifically interested in a United Healthcare plan, then I would visit uhcmedicarehealthplans.com.
Amanda, I really want to thank you for joining me this morning.
Thank you so much.
Have you ever wished your community felt a little more connected? A lot of people feel the same way. And Allstate is launching a major effort to help nonprofits strengthen these bonds. We're talking with Louise Packard, Director of Thought Leadership at Allstate, about the Trust in Practice Awards and how a $5 million commitment could spark some real change. Louise, welcome.
I'm great. Thank you so much for having me.
We're happy to have you. Why is rebuilding trust such a critical part of creating stronger, more connected community?
Well, trust is essential to a strong and healthy community, but unfortunately, as you noted, trust is in decline. Recent Allstate research shows just 41% of Americans trust one another, consistent with the decline in trust we've seen over the last 3 decades. And we know that trust is critical to enable community support. People who say they're more likely to trust one another are also more likely to help one another, which creates a culture of caring and mutual aid. This is important to Allstate because we believe that trust can be built locally. Initiatives that build trust within our neighborhoods, our schools, our community organizations also lay the groundwork for broader societal change and unity. There is good news, and that is that 74% of Americans feel optimistic about the future of their local community. And community trust builds national strength. High levels of individual and community trust are linked to really positive outcomes, including a more prosperous economy, healthier democracy, stronger civic engagement, and social cohesion.
And how do the Trust in Practice Awards help nonprofits bring their ideas to life?
The Trust in Practice Awards are designed to support nonprofit organizations coming up with new, innovative, bold ideas to build trust in their community. Selected organizations will receive a minimum of $100,000 up to $1 million to accelerate those efforts.
And what kind of projects or collaborations are eligible for these grants?
Well, we're leaving it to the organizations to come up with those bold and interesting project ideas, so the partnership element is key. Each application should be submitted by one lead nonprofit organization that can demonstrate they are working with at least 2 other nonprofit organizations on trust building efforts. Activities like intergenerational volunteering, bringing different groups together to bridge divides, and other types of civic engagement.
And what small everyday actions can people take to help rebuild trust right where they live?
Rebuilding trust is not only good for our community, it's also good for ourselves. High degrees of trust are correlated with a greater satisfaction with your community, more social interactions, and a willingness to work with people despite differences. So to achieve that, those small everyday actions are key. Volunteering, lending a neighbor a helping hand, simply having a conversation with someone that you might not ordinarily. Those are all actions that have a multiplier effect in creating stronger community ties and unity.
And for anyone interested, where's the best place to learn more or apply?
The Alliance for Social Trust's website. The Alliance for Social Trust is an initiative of Allstate and the Aspen Institute. Together, we're coming and offering this grant application. Our website is also where you can find stories of local trust building to draw inspiration from.
Thank you so much, Louise, for being here this morning.
Thank you.
You ever notice how every conversation about medicine starts with the same thing? The price. There's a new idea floating around Washington that sounds simple on the surface, but a new report warns it could actually slow down access to life-saving treatments here in the United States. Brad Watts is the Senior Vice President of the Global Innovation Policy Center at the U.S. Chamber of Commerce, and he's here to break down what this proposal really means for patients and for the future of new medicines. Welcome to the show, Brad. How are you?
I'm good. Thank you for having me and glad to be here.
Okay, a lot of people have heard bits and pieces about this new drug pricing proposal. Can you walk us through what it actually means and how it would work?
Absolutely. So there's a proposal floating around Washington, D.C. called MFN, or Most Favored Nation style reference pricing. And while it sounds compelling, it's actually very dangerous for American patients. What this proposal would do, in essence, is say that the cost of a medicine in the U.S. will only be the lowest price that is paid in another developed economy. Again, while that sounds nice, what we have seen is in countries that impose these type of strict anti-free market price controls, 2 things happen. First, patients have less choice in terms of which medicine they can take, i.e. some government bureaucrat simply says this is your option. And second, they can wait in these foreign countries sometimes up to 500 days for a new medicine. We all know someone, maybe ourselves, a loved one, a family member, a neighbor, who is dealing with a debilitating disease and needs new treatments and cures. The idea that they could wait up to 500 days to get that if we had price controls, to me, is simply unacceptable. Any day of a delay is one day too many.
All right, one of the big concerns is access. Could this kind of plan make it harder for people in the United States to get new medications?
Absolutely, right? We have a market-based system in healthcare. Right, medical development is done by the private sector. It takes billions of dollars to bring a new medicine to market, and most new medicines never make it to market. They fail. If we take away the ability of private companies to recoup their cost, all that's going to happen is they're going to stop doing that R&D that leads to the next treatment, leads to the next cure. And the reality is a medicine that cures a disease that is never developed costs $0.
And the Chamber's report mentions a potential impact on American jobs. How does drug pricing connect to employment and innovation?
Absolutely. The life sciences sector is one of the biggest employers in this country. As we've seen, the White House has, to their credit, done a fantastic job of working with the private sector to reshore American manufacturing. If these proposals were to move forward, though, these price controls, it's estimated that almost 2.2 million jobs could be lost. And these aren't just normal jobs. These are good-paying jobs, the type of jobs that allow people to achieve the American dream. In Pennsylvania alone, it's 262,000 jobs statewide that could potentially be lost. Right, at a time when so many Americans are looking to achieve that American dream, to get that next leg up, we can't be doing something that's going to undermine some of the very jobs that can let them do that.
And we all want to lower out-of-pocket costs. So what are some ways to make medicine more affordable without creating access issues?
It's a great question, right? The Chamber believes market-based solutions that promote competition are the ultimate answer. And we're already seeing some of this, right? There are companies right now that are developing competing products and competing with each other to get those products to market and to bring down cost. What we can't do, though, right, is import a foreign solution and simultaneously give American patients foreign problems. American patients want choice, they want access, they want speed. Price controls sound nice, but they ultimately take away the ability of patients to have those three things.
And for people who want to read more about the report, where should they go?
We'd love them to come to uschamber.com/price controls. They can find all of our research and information there. And more importantly, they can find a link that directs them to their member of Congress so that they can advocate for market-based solutions.
Brad Watts, I want to thank you for joining me this morning.
Thank you for having me. I'm so glad to be here and hope to come again soon.
Do you ever think about how many people it takes to keep a school running each and every day? It's way more than just the teachers, the bus drivers, cafeteria workers, office staff, and so many others. This week is American Education Week, a national moment to celebrate the entire team behind our public schools. So joining us is Becky Pringle, president of the National Educational Association, to share how communities could get involved and show their support. Becky, thanks for being on the show with us. How are you?
Oh, I'm good. It's good to be back with you, Dan.
All right, we got to start things off. What exactly is American Education Week and how did it all begin?
Well, it started over 100 years ago when the NEA, the National Education Association, actually partnered with the American Legion. We realized in 1921 that it was important to bring awareness and public support for public education because public education is the foundation of our democracy. As it's grown throughout all of those years, we know how important it is, Dan, to lift up those men and women who have dedicated their lives to teaching and nurturing and feeding and counseling our students every single day. So when you say team, that's exactly what we're celebrating this week, is the entire team surrounding our whole students with what they need and they deserve.
So what are some of the key themes you're highlighting for this year's celebration?
Well, actually, today is Education Support Professionals Day. We wanted to take out one of the days in the week to really lift up those educators that don't always get that attention. But throughout the week, we're asking for people to be educators for a day. I got to do that in Arlington, Virginia, a couple of days ago, where I had the opportunity to be with the students and work with them. And I had a chance to talk with and listen to our educators who can tell us if you go into your public schools, they can tell you what they need to provide the kind of resources and support that their students need so that every one of them, Dan, can live and grow and thrive.
So how can parents and local communities show their appreciation during AEW?
Well, Dan, a nice note is always great, a note of thanks and appreciation. But it's going to take more than that. We have so many of our students who are falling into gaps right now. We're all concerned about the cuts to SNAP, where there in Pennsylvania, we depend on the federal government for over $4.2 billion to help our children and our families. And when the federal government doesn't provide those supports, who stands in those gaps? Well, I taught 8th grade science for 31 years, and we do our best. Educators do their best to stand in gaps, but the gaps are so big. There's so many families that are falling into them that we need the support of our parents and our communities to fight for what our public schools need.
The government shutdown has been affecting a lot of areas. How is it impacting public schools right now?
Well, it did certainly when this administration made the decision that it was not going to release SNAP funds to our students and families. That had a huge impact. But I will tell you, Dan, beyond that, a couple of months ago, Congress passed that big, terrible, horrible bill that cut SNAP to historic low levels, cut public education, cut Medicaid. I mean, so we're not just talking about our students, we're talking about our seniors, talking about our families. But all of that impacts whether our students are ready, come to school ready to learn every day. So we need the support, the voices, the power of our entire community to fight for what our kids need.
And for anyone who wants to learn more or maybe take part, where should they go?
Please go to nea.org/AEW, where you can find materials and ideas on how you can lift up all of our educators, the entire team. But not just that, you'll find out, you can get more information about the issues. You can get resources to help you take action so that our students know that the adults in the system, all of them, are sharing the responsibility for all of our students.
Becky Pringle, I want to thank you for joining me this morning.
Always a pleasure, Dan. Thanks.
You ever ignore something and later realize, dang, this actually mattered? Yep, that's vision benefits, especially since eye exams give us a peek into our overall health. Joining us with what we should know before the year wraps up is Mike Bako, Consumer Trends and Wellness Analyst. Good morning, Mike. I'm so happy to have you here, especially because I'm having a hard time seeing you clearly today, so I'm ready for whatever good news you got for us.
Thanks for having me. Great to be here.
So, Mike, why does the end of the year end up being prime time to actually use those vision benefits?
We really are in an interesting moment right now. A lot of people are looking back at the year and looking ahead, but what they might not be thinking about is their unused vision benefits. And that's why this is the perfect time to use them before they expire. So whether you wear glasses like me, contacts, or nothing at all, that annual eye exam is going to be one of the most valuable appointments that you make before the year wraps up.
And what are some things an eye exam can spot that go way beyond just checking your prescription?
Yeah, so a comprehensive eye exam is far more than just checking your sight. It's not just about the numbers and the letters that we're used to. It's a small window into your overall health. In fact, an eye doctor can detect up to 270 underlying health conditions. So that's everything from diabetes and high blood pressure to things like heart disease. And yet, even with all this information, millions of Americans are letting those benefits go unused every year.
So I actually wear contacts myself because I break my glasses so often. So these Flex-On's bend back technology sounds pretty cool. What makes these frames so durable?
Yeah, it's right up your alley. You might want to consider this. And it's something that I consider, and that's why Flex-On is so perfect for my lifestyle as well. But let me tell you a little bit about them. They use memory metal, which was originally discovered by NASA. That's what makes these frames so durable. And unlike regular metal glasses, you could bend, flex, and twist them, and they'll still return to their original shape. And as a dad of 2 boys, we're always on the go. So when I'm wearing these frames, whether we're on a family hike or playing in the park, running around, playing sports, they're really engineered to handle whatever life's challenges throw at them. And as you can see, I'm wearing these rectangular frames in gunmetal. They've become one of my favorite. But what I love about Flex-On is that there are so many easy to wear shapes and colors, and the frames are designed to stay in adjustment. Check this out. They bend and pop right back into shape. They're stronger and more corrosion resistant than standard metals, and they're also super lightweight and comfortable. And let's talk a little bit about the pricing. Flex-On frames, they start at $194 and they go up to $332. Let me show you an array of color options as well. Gold, gunmetal, coffee brown, and matte metal tones with shapes like rectangular, round, and square. So there's really something for everyone.
And Flex-On's been a go-to brand name for years. What is it about the brand that makes people keep coming back?
Yeah, there's a real loyalty that's built in with the millions of people that have these frames. It really revolves around innovative resilience. They're a trusted brand for more than 30 years. And like I mentioned, millions of frames have been sold, and their unmatched reputation for reliability is out there for everyone to see who has these. And for people that don't or do, you could go to flexon.com and use the Find a Retailer section. This is going to show you the nearest store with Flex-On frames. Plus, when you use your unused vision benefits, you could use them towards a new frame.
Mike, thank you so much for being on the show today.
Thank you.
Let's talk music, because I am so excited about our next guest. You know those bands that didn't just soundtrack a moment, but they shaped whole entire chapters of your life? Well, for me in high school, this band was a major part of those formative years. And to this day, when I hear a certain Dr. Feelgood, still gives me all the feel-goods. Motley Crue is celebrating 45 years and bringing back their legendary Carnival of Sins tour for 2026. Today we have drummer Tommy Lee with us to talk about the band's wild ride and what fans can expect this time around. Tommy, welcome. So thrilled to have you.
Hello, good morning.
So, Tommy, this tour, it marks 45 years of Motley Crue and the return of Carnival of Sins. Why did this feel like the right moment to bring this tour back?
Well, because it was insane when it happened, and there's so many new fans and that never really got a chance to see it. And I was just telling somebody else this, and our music has transcended generations, and there will be so many people that are coming to see this for the first time. So, let's bring it back and let's show them what they missed.
That sounds good to me. And speaking
Right?
of, spanning generations, your fan base, me included, why do you think that connection is so strong after all these years?
I don't know. I really don't. There's some magic there. I was telling somebody else, there's nothing cooler than that. Like, I think after the movie The Dirt came out, I got so many emails from people going like, "Oh my God, is that what it was? Is that really what it was like?" And I think there's a bunch of stuff out there, during our career and our lives that just don't happen anymore, and they never will. So I guess I don't know where I'm going with this, but there's nothing cooler. There's not a better feeling for an artist to look out in the crowd and see, their parents have their children on their shoulders, and they're up there going like, "Yeah, shout, shout," and you're like, "Dude, you're like 9 years old. How is this happening?" It literally is the best feeling ever to know that your music has transcended, and these new people are coming in and they're seeing it for the first time, and it's mind blowing.
I love that. So fans still talk about the original Carnival of Sins tour. Are there any parts of that huge over-the-top production that are coming back, or what's brand new for this tour this next year?
If I told you, I'd have to kill you. No, I'm just kidding. No, we're deep in pre-production now. This one's going to take a lot of time because, as usual, every time we go out, it's a spectacle, and people expect us to bring something that they've never seen before. So we have a heavy load on our shoulders, but we're talking, like I said, we're in pre-production and talking about different musical ideas and production ideas, and there's some new technology out there that we're going to bring, and we're going to bring it like we always do.
Heck yes. Tickets for the return of the Carnival Sins tour are on sale now. You can find dates, details, and the full tour lineup at motley.com. Thank you so much, Tommy.
Yeah. Thank you so much.
Yeah.
Have a great day.
That's it for Rise and Unwind. I want to thank you for tuning in and checking out the show. If you actually want to be on the show, go to our website. That's riseunwindtv.com. Fill out the form, send it on in, and maybe you could be on a future episode. We also are on social media. We're on Facebook. We're on Instagram. Plus, we have a YouTube channel. All of those can be found at Rise Unwind. Make sure you like, you comment, you share, subscribe, click the bell button. All the stuff that YouTubers say helps us out too. And until next week, that was Rise and Unwind.